In this presentation, I'm going to talk about gastrointestinal drugs. First, H2 blockers consist of cimetidine, ranitidine, famotidine, nizatidine. Mechanism of action. They reversibly block of histamine H2 receptors on surface of parietal cells of stomach, decreased acid secretion by parietal cells. Clinical use: peptic ulcer disease, gastritis, mild esophageal reflux disease. H2 blockers adverse effects. Cimetidine is a potent inhibitor of cytochrome P450. It has also anti-androgenic effects, including prolactin release, gynecomastia, impotence in men, decreased libido in males. Can cross blood-brain barrier, causes confusion, dizziness, headache. It can cross placenta too. Cimetidine decreases renal excretion of creatinine, but other H2 blockers are relatively free of these side effects. Proton pump inhibitors: omeprazole, lansoprazole, esomeprazole, pantoprazole, dexlansoprazole. Mechanism of action of proton pump inhibitors: irreversibly inhibit HK-ATPase in parietal cells. Clinical use: peptic ulcer disease, gastritis, esophageal reflux disease, Zollinger-Ellison syndrome. It is a component of H. pylori therapy and stress ulcer prophylaxis. Adverse effects: increased risk of Clostridium difficile infection and pseudomembranous colitis, acute interstitial nephritis, and vitamin B12 malabsorption. Antacids consists of aluminum hydroxide, calcium carbonate, magnesium hydroxide, aluminum magnesium hydroxide, aluminum magnesium hydroxide plus simeticone. In general, antacids can affect absorption or urinary excretion of other drugs by altering gastric and urinary pH or by delaying gastric emptying. All of them can cause hypokalemia. Antacids neutralize stomach acid to cut down on heartburn, sore stomach, acid ingestion, and stomach upset. Simeticone in some antacids helps your body get rid of gas. Some antacids contain ingredients that can cause diarrhea, such as magnesium, or constipation, such as aluminum. Bismuth subsalicylate. Bismuth subsalicylate is used to treat diarrhea, heartburn, and upset stomach. Bismuth subsalicylate is in a class of medications called antidiarrheal agents. It works by decreasing the flow of fluids and electrolytes into the bowel, reduces inflammation, and kills organisms that can cause diarrhea. Clinical use of bismuth subsalicylate: increase ulcer healing, traveler's diarrhea. Bismuth also used in quadruple therapy for H. pylori. Sucralfate. Sucralfate is used to treat and prevent the heartburn of duodenal ulcers. Sucralfate is in a class of medications called protectants. It sticks to damaged ulcer tissue and protects against acid and enzymes, so healing can occur. Sucralfate requires acidic environment not given with proton pump inhibitors and H2 blockers. Clinical use of sucralfate increases ulcer healing. Misoprostol. Misoprostol is a prostaglandin E1 analog enhancing production and secretion of gastric mucus barrier and decreases acid production. Clinical use. Prevention of nonsteroidal anti-inflammatory induced peptic ulcers because NSAIDs block prostaglandin E1 production. It is also used off-label for induction of labor in combination with mifepristone. It is contraindicated in patients of childbearing potential. It also used to manage miscarriages, prevents postpartum hemorrhage. Of course, mifepristone, also known as RU486, is a selective antagonist of progesterone. Adverse effects of misoprostol. Diarrhea, contraindicated in patients of childbearing potential. Octreotide. Octreotide is a long-acting somatostatin analog, inhibits secretion of various splanchnic vasodilatory hormones. Octreotide inhibits exocrine pancreatic secretions and thereby reduces the fluid production by pancreatic fistulas. It is inhibitors of growth hormone, glucagon, and insulin too. Clinical use of octreotide. Acute varicose bleeds from esophageal varices. Acromegaly, VIPoma, carcinoid tumors of the GI tract. Sulfasalazine. Sulfasalazine is a combination of sulfapyridine, antibacterial, and 5-aminosalicylic acid, anti-inflammatory. Sulfasalazine activated by colonic bacteria. Clinical use of sulfasalazine, ulcerative colitis, Crohn's disease, for colitic component of the disease, adverse effects, malaise, nausea, sulfonamide toxicity, reversible oligospermia. Loperamide. Loperamide is an agonist at mu opioid receptors, slows gut motility. It has a poor CNS penetration, so low addictive potential. Clinical use of loperamide. It's used for diarrhea, adverse effects, constipation, nausea. Ondansetron. Mechanism of action. Ondansetron is a 5-hydroxytryptamine 3 antagonist, acts peripherally and centrally. It is a potent antiemetic drug. Clinical use of ondansetron, control of post-operative vomiting, control of vomiting in patients undergoing cancer chemotherapy. Adverse effects, headache, QT interval prolongation in ECG, serotonin syndrome. Aprepitant. Mechanism of action. It is substance P antagonist, blocks neurokinin 1 receptors in the brain. Clinical use of aprepitant. Antiemetic for chemotherapy-induced nausea and vomiting. Metoclopramide. Mechanism of action. It is a dopamine D2 receptor antagonist, causes increased resting tone, contractility, lower esophageal sphincter tone, promotes motility, gastric emptying. It does not influence colon transport time. Clinical use of metoclopramide, diabetic and post-operative gastroparesis, antiemetic, persistent gastroesophageal reflux disease. Adverse effects of metoclopramide increases Parkinsonian effects, tardive dyskinesia, restlessness, drowsiness, fatigue, depression, diarrhea. It is contraindicated in patients with small bowel obstruction, Parkinson's disease due to D2 receptor blockade of dopamine receptors, decreases seizure threshold. Orlistate, mechanism of action, inhibits gastric and pancreatic lipase, so decreases breakdown and absorption of dietary fats. It is taken with fatty meals. Clinical use of orlistate, weight loss. Adverse effects, abdominal pain, flatulence, bowel urgency, frequent bowel movements, staturia, decreased absorption of fat-soluble vitamins. Laxatives. Bulk-forming laxatives consist of psyllium, methylcellulose. Mechanism of action, they are soluble fibers that draw water into gut lumen, forming a viscous liquid that promotes peristalsis. Adverse effects, bloating. Osmotic laxatives, magnesium hydroxide, magnesium citrate, polyethylene glycol, lactulose. Mechanism of action, provides osmotic load to draw water into GI lumen. Lactulose also treats hepatic encephalopathy. Gut flora degrade lactulose into metabolites, lactic acid and acetic acid, that promote nitrogen excretion as NH4 positive. Adverse effects, diarrhea, dehydration, may be misused by patients with bulimia nervosa. Overuse may cause metabolic alkalosis. Stimulants, Sena, bisacodyl. Mechanism of action, enteric nerve stimulation result in colonic contraction. Adverse effects, diarrhea, melanosis coli, overuse metabolic alkalosis. Emollients, docosate. Mechanism of action, docosate promotes incorporation of water and fat into stool. Adverse effects of docosate, diarrhea, overuse may cause metabolic alkalosis.